Okay, so we were actually talking about the benign tumor and tumor-like lesions which are present in the infancy and childhood. Remember that the most important benign tumors which are present in the infancy and childhood are your hemangiomas, which are actually tumors of the endothelial cells, lymphangiomas, which are the tumors of the lymphatic system, uh, teratoma, and fibrous tumors. Now, the lymphatic tumor setting, you are actually visualizing the two pictures. The one is actually the lymphangioma of the tongue, and the other is the lymphangioma of the uh, cer cervicofacial region or cervicofacial region. And this, the large lymphangioma which you're actually seeing on the neck is called cystic hygroma as well. Okay. Lymphangioma, just like hemangiomas, are actually the benign tumors of the lymphatic system, and they may be hematomatous or neoplastic in origin. We've already discussed that hematomatous are actually excessive focal growth, which are in the native tissue. Okay, that is the growth of the cells in their original tissue. Okay. While on the other hand, there's another term which is called lymphangiectasis. And there's a difference between lymphangioma and lymphangiectasis. Lymphangiectasis is actually the normal dilation of the pre-existing lymph channels. And so that's why it's called lymphangiectasis. And the lymphangiomas are actually characterized by cystic and cavernous spaces. I'm not so sure about the difference between the cystic and cavernous spaces, but I think the cystic space is actually the closed space or the closed cavity, while the cavernous space is actually the cavity, anatomical cavity, having interconnections. Two spaces may have some kind of interconnections. I think they mean the same, but I don't know. I googled, but I did not really get uh, the true definition of both the spaces. Yeah. So yeah, the lymphangioma lesions you will see in skin, but mostly you would find in the deeper regions of the neck, in the axilla, mediastinum, and in retroperitoneal tissues, and also in other spaces. Although these lymphangioma are actually benign, but they do tend to increase in size because of the accumulation of fluid, the lymph, obviously. So because they're actually growing due to the accumulation of fluid, they try to reach on vital structures. They're not actually localized. They do try to reach on vital structures. For example, the vital structure which are present in the mediastinum, or the nerve trunks which are present in the axilla. Because we have seen the cystic hygroma, which is actually lymphangioma of the neck, which was progressively increasing in size and was almost affecting the whole neck, and that give rise to clinical problems. Lymphangiectasis, in contrast, is diffuse swelling of part or all of an extremity, and this can also cause considerable distortion and deformation. However, the lesion, like lymphangioma, is not progressive and does not extend beyond its original location. So, the only problem which is present in lymphangiectasis is actually the cosmetic problem. You can see the first is actually picture which we're seeing in figure 1023. This is actually congenital capillary hemangioma at birth, and at 2 years of age, which is on figure B. And after spontaneous regression, you can see that almost there is no hemangioma anymore. Now we're going to discuss about the second type of tumor, which is actually a fibrous tumor, and we will discuss it in the next section. Have a nice day. Okay, sorry.